You do not need 5 research methods. You need one answerable question. But this is how many proposals begin to lose focus. Interviews sound deep. Surveys sound scientific. Focus groups, observation, mixed methods, each one feels like another sign that you are taking the work seriously. But when your methods become bigger than your question, the proposal does not look ambitious. It looks unfocused. Complexity is not quality. A defensible design wins. Your supervisor is not looking for the most impressive methodology. They are looking for a clear line between what you want to know, what evidence would answer it, and whether your plan can realistically produce that evidence. First, I will clear up one common confusion. A survey is not your research design. An interview is not your research design. A focus group is not your research design. Those are tools. Your design is the overall logic of how you will answer the question. Cross-sectional, qualitative, cohort, experimental, mixed methods. Think of it this way. Your design is the map. Your tools are what you carry on the journey. To choose a design that makes sense, use a 3-part test. What is my question really asking? What evidence would answer it? And what can I realistically complete? Start with the question, not the method you saw in someone else's thesis. If you are asking how many people experience something, how common it is, or whether things are associated, you probably need quantitative data. You need numbers. If you are asking how people experience something, why they make a decision, or what shapes their behavior, qualitative methods may fit better. You need explanation, meaning, and context, not just a percentage. If you are asking whether an intervention changed an outcome, you need some form of comparison. Before and after, an intervention group and another group, or a trial. Big claims need stronger evidence. Sometimes you need both numbers and explanation. But mixed methods is not a survey plus a few interviews because that feels thorough. Use it when you have 2 linked questions that genuinely need 2 kinds of evidence. Next, ask what evidence would convince a reasonable reader that you answered the question properly. Numbers can estimate how common something is. Interviews can explain why it happens. Comparisons can show whether change is plausible. Do not collect data because it is available or because a template told you to. Collect it because it is necessary. The method should follow the evidence you need, not the other way around. Then do the reality check. Can you access the right participants, recruit enough people, obtain approval, afford the work, and analyze the data? A design can be interesting and still be wrong for your project. A small, well-executed study is stronger than an overambitious study that collapses halfway through. So here is the whole matrix. Start with the question. Identify the evidence. Then choose the most feasible design that can produce it. Not the fanciest design. The clearest route from question to credible evidence. Example 1. What proportion of university students have used emergency contraception in the past year, and which factors are associated with use? This is mainly a numbers question. You want a proportion. You may also want to compare groups or examine associations. That points toward a quantitative design, probably a cross-sectional survey. Could you add interviews? Yes, but only if you have another question that needs explanation. Do not add methods just because they look more serious. Example 2. How do women experience contraceptive side effects? And how do those experiences shape decisions to continue, switch, or stop a method? Now, the question has changed. A survey can tell you that side effects were reported. It may not tell you how women understood them, managed them, discussed them with partners or providers, and made decisions over time. Here, in-depth interviews may be the strongest starting point. You need accounts, language, sequence, and context. That is what qualitative research is for, not because it is softer, but because it fits the evidence you need. Example 3. Does provider training improve respectful family planning counseling? This is a change question. You need to measure counseling quality in a way that allows you to assess change. Depending on your resources, that might be pre and post, a comparison group, or a trial. The choice depends on the claim you want to make and what is feasible. A simple before and after study may show improvement. Without a comparison group, be cautious about saying that training caused it. Your design determines what you can credibly claim. Now run a chaos check. Look at every survey, interview, focus group, observation, or document review in your methods section. What exact research question does each tool answer? If you cannot answer that clearly, it may not belong there. 5 tools do not automatically equal rigor. They may just mean 5 different ways to create unnecessary work. Every tool has to earn its place. Use this sentence to test your design. To answer my question about topic, I will use design among population because it will generate specific evidence within my practical constraints.
For example, to understand how women experience contraceptive side effects and make decisions about continuation, I will conduct in-depth interviews with current and recent contraceptive users because interviews can generate detailed accounts of experience and decision-making within the available study period. That is stronger than saying I will use qualitative methods because they provide rich data. Rich data is not a reason. The question is the reason. Good research does not begin with a method. It begins with a question clear enough to guide every decision after it. Start with the question. Identify the evidence. Choose the most feasible design that can produce it. Then your method section becomes an argument you can defend.